Former White House COVID response coordinator, Dr. Deborah Birx. Good morning to you, doctor. Thank you for joining us. What are your thoughts on this announcement? What's the most important takeaway for parents here?
I think what the moms said. The moms are frustrated. First, we tell them it's a spectrum disorder, so it's not really a precise diagnosis in their hands. And then we're telling them all the things that it's not caused by, but not what it is caused by. And I think what I really took home from that is, yes, there is this relationship that has been demonstrated with Tylenol. So women, that doesn't mean it caused it. It also means that maybe those moms were sick and they took Tylenol. Maybe it was linked to a virus. We really don't know precisely right now, but what I also heard is them really working on getting these databases to really understand, is it genetic? Is it environmental? Is it a combination? Is it drugs? We have to know, because we owe it to the 3% or so of the population now with autism to really start to define this. Because if we know what causes it, we can stop it. But also, if we know what causes it, we can help to get more precise treatments. And then I really heard that they're really going to work on treatments. They brought the first one forward that has been showing promise in certain cases. And I think what CMS has said and what the FDA has said is we're going to make this available to parents that need this. So I think it's a step forward in autism. It's taking it to the national stage. It is a big problem in America, and we had to figure it out.
Yeah, doctor, I mean, we saw during COVID, the legacy media all over, trust science, trust science. Now they're skeptical. I mean, there was a 43 peer-reviewed studies, a review of them done by Harvard, suggesting a link between autism and acetaminophen. The Harvard Dean of Public Health releasing a statement saying, we found evidence of an association between exposure to acetaminophen during pregnancy and an increased risk of developmental orders in children. Again, I think the key word there is association, not causation. But the fact that many in the mainstream media don't even want to talk about it, I think is just wrong.
And I think it was right to highlight that during the press briefing to make it clear to parents they saw this association. And it's not just autism. They saw an increased incidence of, attention deficit disorders and neurodevelopment disorders in children. And so I think it was anchored by this understanding that we have how important folate is in pregnancy. So if you want to get pregnant, let's really work on your folate levels before, during, and after. And this link of a potential to say to people, we don't know precisely if it's Tylenol, but to be safe, if you have a choice, try not to take it. And I think for moms out there, it's a step forward to say, we're going to work on this and we're going to figure it out.
Yeah, I'd like to take a listen now to Acting Assistant Secretary for Health, Dr. Dorothy Fink's statement from Monday. Take a listen.
It's hard to hear information that challenges the status quo. We are sharing this information not to confuse, but to empower parents to make the best choices when taking medications during pregnancy.
And I think that's the big message that so many people should take away from yesterday's news conference is they're just trying to empower parents and give them more information. What did you make of that?
Yeah, and I think I heard that from both the moms. They want to know why. And I think that's understandable. It isn't good enough to say it could be these 10 different things. It can be in genetics. It can be environment. It can be what you eat. It can be what you take. It can be this and that. They want to know what caused the problem in their child so they can prevent it in other children. And I just think there's a bravery there among the moms. And when you're talking about 3% nearly of the children in the United States with autism, it is a problem that we should be addressing at all levels. And what I was excited about was they brought the CDC, the FDA, the NIH, all of them together in CMS and said, we're taking this seriously. We're going to build databases. We're going to really try to come out of this with a better understanding of how to prevent it and how to treat it.
I think it's important to remind people that we are talking about pregnant women and young children in Tylenol. If you're not in those categories and you need it, probably no one, I've not seen anyone say you shouldn't be taking Tylenol or acetaminophen.
Right. All right, Dr. Deborah Birx, thank you.
Information. Truth is freedom. Is Newsmax. It's real news for real people.